So I would gather my supplies for nail care. I'd wash my hands and get a towel. I would go into the resident room, knock on the door. Hi Annie, I'm Myra, I'm your CNA today.
Hello.
Are you ready for some nail care?
Yes.
Okay. I'm gonna wash my hands again in the room. Put on my gloves. And then I would get their basin and put some warm water in the basin. Then I also have a manicure stick, also called an orange stick. I have an emery board and a nail clipper. Nail care is typically done on the bath day, so at least once a week. We should at least check the nails. Not that they necessarily need to be cut and filed all that time, but they should be checked to see if they're smooth, so the resident doesn't cause any skin issues to themselves. Just to be sure that everything is clean, I'm going to take an alcohol swab and wipe off the clipper. So you never know if somebody else used it or it fell on the floor or something. Okay. Annie, I'm going to have you sanitize your hands before you put them in the water. And then I'll sit next to you and touch the water and see if that's okay before you. Okay. So you can go ahead and put your hand in. And then Annie would usually soak 5 to 10 minutes or so. This softens the skin to help get it clean, and then it also loosens any of the debris that might be underneath the nails and make it easier to clean, and it's not so, doesn't bother the resident as much. So after 5 minutes, I'll have her take her hand out and place it on a towel and then dry that off. So with the pointed part of the orange stick, I'm going to hold her, she's still a little wet. I'm going to hold her nail or her finger in between my fingers and gently go under her nail, and then I'm going to wipe that off on the towel. We want to do the cleaning part first so we can see how far, if you do need to cut, we can see where that white part is, so the separation, so there's not skin underneath the nail and we're not cutting the nail. If the resident is diabetic, then you do have to have the registered nurse cut their nails. Again, because any cuts in the skin, they're more apt to get infection. And so after every nail, I wiped off on the towel to make sure that I don't spread any debris from nail to nail or any pathogens. Okay. If I did need to cut her nails, I would do that at this point. We already had the clipper cleaned, and so I would do the same thing, hold her nail or hold her finger so it doesn't move, and then gently clip. I would do that for all 5 nails. And then lastly, I would take the emery board. So if you're familiar with sandpaper, there's different grits or smoothness. So the darker side will you use first to get the most nail filed, and then this will smooth out the nails, the lighter side. And you can always just feel through your glove which side is coarse and which side is fine. And then we want to go from the outside of the nail towards the inside, or to the middle of the nail. So I would use the coarse side first and then come back with the smooth side, outside in. And then I'm going to feel the nail with my glove to make sure there's no snags. If there are snags, I want to make sure I go back and file again, so again they're not snagging themselves or snagging something on their clothes and then the nail rips. So we'll check that all those are smooth after I've cut and filed all of them. Okay, and you can put your hand back in the water and rinse off any of that nail dust. Okay, we'll pat everything dry. Would you like some lotion?
Sure.
Okay. So we'll warm up the lotion with your gloves on, and then just make sure we cover our entire hand. And just like the toes, we don't want to get anything in between her fingers, but we want to make sure we cover all the skin on her hand. Okay, does that feel okay?
Yep.
All right, so we repeat the same thing on the other hand. And then I would take my basin to the sink, dump the water, wash it with soap, rinse it, dry it out, return it to the nightstand or wherever it's kept. I take my gloves off. and put those in the garbage. Sanitize my hands. Is there anything else I can get for you? Okay, and then make sure her call light is within reach, and then report anything that would need to be to the nurse if there is any skin issues with her hands.